Hi, I'm Dr. William Sexton in the Department of Pediatrics at Emory University School of Medicine. Today we're going to talk briefly about blood-borne pathogens. These are infections, usually viruses, that are contained in blood and other body fluids that may cause disease. First thing we need to consider is how do you get these infections. The most common ways are to be splashed, cut, or stuck with something so that the infected blood is actually injected into your body. Another way of getting this is if you have an open sore or a cut, and that open sore or cut has exposed the infected fluid. So how do you go about protecting yourself? Well, the first thing is to wear gloves, especially latex gloves, when you're doing chores where you might come into contact with infected fluid. If you're doing heavy-duty chores like cleaning up trash and that kind of thing in the community, you could consider wearing leather gloves with latex gloves underneath them. Consider wearing glasses or protective goggles if there's any risk at all that you could get a splash in your eyes. Something to consider is that all trash should be treated as if it contained blood or body fluid and was therefore infected. If you see a blood spill, it should be cleaned up with Clorox diluted with water in a 1:10 dilution. Be sure you wash your hands often. Do not eat in areas where there may be contaminated items. And if you're cleaning up large items, be sure that you use a shovel or a dustpan. Do not use your hands, even if you're wearing gloves. If you are exposed, wash that part of your body copiously with soap and water. Notify your project supervisor and go to the emergency room immediately for assistance. And finally, as a preventive measure, be sure that you're responsible not only for yourself, but the other people around you, and remind them if you see them doing something dangerous.